So hello and welcome and thank you for joining the Thomas Expert Series. We're going to get started in just a second. In the meantime, I want to ask everyone to go ahead and mute their mic. It looks like everyone already is, so fantastic. This expert series will be recorded and placed on demand, so please let your colleagues know how much you enjoyed the presentation today. Just to get everyone a little familiar with the chat, I wanted to see where everyone's tuning in from today.
Well, I'm outside of Philadelphia.
Awesome. Got a Dallas in there.
Mexico.
Oh, Mexico. Cool.
Pittsburgh.
Awesome.
Atlanta.
Sounds like we've got some places all over.
It's great.
All right. So at this time, I'm going to go ahead and turn it over to a safety nerd, Linda Harvey. She is a risk management consultant. She's here to talk about compliance and worker safety in clinical pathology.
Well, thank you very much. It's my pleasure to be here with you all this afternoon. So I'm going to share my screen as we get started. So again, thank you for joining us today. It's my pleasure to be here with you. My name is Linda Harvey, and I am happy that you have chosen to join us for clinical and compliance safety in your world. So as we think about getting started this afternoon, I'd like to just think about the fact that, safety resonates with all of us. And here we are coming together to talk about updates for our safety protocols. And if you're like me, I've heard many different types of stories and slogans over the years about safety and safety phrases. So they serve to encourage us and as a reminder of our safety to keep top of mind. So some of these clever slogans and programs that have stuck out in my mind have been stay alert, don't get hurt. If you see something, say something. And let's not meet by accident. Actually, today, I think that slogan best fits this presentation because it's not by any accident that you've chosen to brush up on your safety awareness by attending today's presentation. And as we get started, I would like to just say and also thank that this presentation is sponsored and supported by Owens & Minor Halyard and made available for information and educational purposes only. And the opinions that are expressed today are mine, but we're going to do our best to stick to the facts and nothing but the facts as we go through. And if I have an opinion, I'll be sure that I express it to you explicitly. As we start our program, there are 4 objectives that we'll cover. First, we'll define the culture of safety in clinical pathology settings. We will identify applicable safety standards, guidelines, and laws. And we'll discuss specific applicable safety standards and the consequences of noncompliance. And lastly, we'll propose some practical tips for maintaining high standards in your workplace. When we think about establishing, sustaining, and even nurturing a culture of safety, it starts with a conversation about culture of a workplace. Overall, we think of culture as a set of shared attitudes, values, goals, and practices that characterize an institution or organization. So when we think about values, for example, we think about standards as of behavior that are considered important or desirable. And certainly, I think we'd all agree there are safe work practice behaviors and there are risky behaviors. And when we think about attitudes, those are the result of our experience or upbringing. Yet, as we know, they can change over time. So for our conversation today, let's consider one's attitudes towards safety and following safety guidelines. Then let's apply organizational culture to a culture of safety itself. And I think you would agree these 2 points really fit nicely. First is the fact that a safety culture exists when an organization places a high level of importance on safety beliefs, values, and attitudes. And then second, that these beliefs, values, and attitudes are shared by the majority of the people within the organization. It's the way we do things, as we saw on the slide before. So you may be wondering, what are some examples of the safety of culture? So let's look a little bit further. And I'd like to draw some examples of the safety culture from these 5 important key elements or characteristics, if you will, that you would expect to see in organizations with a culture of safety. And we just mentioned shared values. So one important value, I believe, is compliance. as well as being knowledgeable of the applicable standards and guidelines and laws. Second is leadership participation. This consists of the leadership buy-in that we always hear about. So in our case related to safety, this also means that everyone's walking the same walk, and that leadership from the executives to the managers and the supervisors all share the same beliefs and values that they expect the teams to buy into. Third is continuous learning, sometimes referred to as lifelong learning. You know, recently I read an article on LinkedIn about the benefits of continuous learning. There were a few points that really resonated with me that I'd like to share with you. They were change your perspective and pay it forward. You see, I felt that those points weren't as top of mind as some of the other benefits of continuous learning. And if you don't mind, I'd like to circle back to those later in the program. But moving forward, accountability number 4 is defined as the responsibility for the fulfillment of obligations. So again, in our world of safety, it relates to fulfilling our safety responsibilities along with helping and holding one another accountable for being part of the safety process. And last but not least is ongoing support. I believe that no program, organization, or plan is successful without ongoing nurturing. And then from the business perspective, I think of nurturing as that ongoing support as having consistent and dedicated assistance. Consistent and dedicated assistance, whether that assistance is time, talent, or resources. And I bet if we put our heads together, we could come up with any number of examples of support. I think of things first and foremost as financial support. Are we able to upgrade our safety equipment when it's time to do so? Are we able to obtain additional learning and education through conferences or having a consultant come in? Any number of different financial areas we could see support, as well as participation of leadership in safety meetings. That speaks volume, doesn't it, about leadership participation? So of these 5 elements, I encourage you to identify what resonates most with you. And if you're like me, it's hard to say that one element is better than another. But I'm going to ask you to put into the chat window, where do you think you or your team shine the most? And we'll talk about these later in an anonymous format. We won't call you out, but put something in the chat window. We'd like to know which one of these resonates the most with you, or where do you think your team particularly shines? So with that in mind, with those 5 elements, it presents the question, why is the culture of safety important to your health? Let's look at some fast facts from a USP infographic that represents just one facet of lab safety. First is more than 8 million US healthcare workers are exposed to hazardous drugs every year. And more than 12 billion doses of hazardous drugs are handled by US providers each year. And then secondarily, there are definitive acute and long-term effects if these hazardous drugs are not handled safely. These are some staggering facts. Yet as healthcare professionals, we face many other safety hazards, including blood and bodily fluids and hazardous chemicals. So most definitely, a culture of safety is important to your health. So thus far, we've discussed the importance of a culture of safety, 5 key elements, and how they're recognized dangers if hazards aren't handled properly. But that begs the next question: who guides us in our quest for safety? This program addresses 4 organizations and agencies that direct our safety journey. There are the Occupational Safety and Health Administration, OSHA, the Centers for Disease Control, CDC, the U.S. Pharmacopoeia, USP, and the American College of Pathologists, the College of American Pathologists, CAP. Each of these 4 publish guidelines and standards and laws related to safety. And among them, there's some overlap as well as distinct differences. But ultimately, not following standards and guidelines and laws can lead to safety mishaps from an unsafe workplace due to non-compliance. So looking at OSHA first, OSHA's standards govern worker safety in all industries in all 50 states and provinces. However, some states have developed more stringent standards than others and have developed more stringent standards than the federal law, in which case OSHA has approved those state plans. Just to cite one example is Michigan. MyOSHA, or the Michigan OSHA, has a more stringent bloodborne pathogen standard that has the approval of federal OSHA. So briefly, if you're not clear whether OSHA or the state plan has anything more stringent, then we encourage you to look at the resource slide that I'm going to have at the end, so you can grab the OSHA website and double check, do you have the most current OSHA standards on file, or what do you need to look at to update for your OSHA state approved plan, if applicable. But we've been following both of these standards since the bloodborne pathogens since the early 90s and hazard communications since the late 1980s. And you'll see these pictograms here that I will mention later when we just say a few words about the hazard communication standard. These symbols we became familiar with 10 years ago, back in 2012, actually 11 years ago now, when OSHA updated the hazard communication standard. So looking briefly at these individually, we can ask the question, why do we care about the bloodborne pathogen standard? The purpose of this standard is to protect all healthcare workers from contracting a bloodborne disease in the workplace, whether it's HIV, hepatitis B, and hepatitis C. And if you've been in healthcare as long as I have, you can remember that the driving force behind this standard was the HIV scare in the 1980s. And if you've been in healthcare like I have a long time, you know that back at that time, there was no hepatitis C. It was non-A, non-B because it wasn't identified yet. So there's been so many changes over the years, hasn't there? But if your work includes any work with bodily fluids, then this standard applies to you and your lab. Among some of the applicable bodily fluids, just to name a few here, are cerebrospinal fluid, synovial fluid, any fluid that's visibly contaminated with blood, all bodily fluids in situations where it's just difficult or impossible to differentiate. It also involves working with unfixed tissue organs from humans, living or dead, and anything related to HIV containing cells or tissues or cultures and organs, all is applicable and has to follow, you all have to follow the bloodborne pathogen standard in that case. So of all the requirements for this standard, I've called it down to just 4 top sections that I wanted to briefly mention and refresh you today as far as your safety awareness update. First is to be sure that you're familiar with your occupational exposure to blood and other potentially infectious materials. You see, in this standard, OSHA requires that the employers go through and analyze everybody's job description to determine what's your exposure level. So if you're working in the clinical environment all day long, then all of your duties involve exposure to blood and bodily fluids. So you would be in a class 1 or category 1. Whereas with someone else within the organization, say someone in the billing department or other area, administration or something whatnot, may be totally separate from where you are and never set foot in your lab. That's the opposite end of the spectrum. But nevertheless, you still must have an exposure control plan that has to be reviewed and updated annually. And as well, along with that comes the post-exposure management plan. That plan comes into play that even though you put your best effort forward to be safe, but you still get some kind of poke, cut, splash, you have to know how to handle that carefully and where to go to seek follow-up care. And the post-exposure management plan spells that out nicely. And last but not least is training upon hire and annually thereafter. OSHA is very specific about the points that have to be included in the bloodborne pathogen standard for annual training. And OSHA is very specific about the fact that you must include your training once every 12 months, not just once in a calendar year. So to briefly say that if you work in an HIV and hepatitis B research laboratory or production facility, then this particular section of the bloodborne pathogen standard applies to your lab as well. And while time doesn't permit going into this in great detail, I just want to bring it to your attention that this is part of 1910.1030 subsection E. So this would be a particular section that you would have your policies and procedures all outlined and applicable to that setting. Next is OSHA's hazard communication standard. This standard, again, we've been following it since the late 1980s, and it's related to worker safety with hazardous chemicals, such as the cleaning solutions and disinfectant products used in laboratory settings, just to name a few things. And we know that this is different than the hazardous drugs under the USP guidelines, for example. And again, I've called this down to just 4 of the main components that are required for this standard. First is having a hazard communication policy or plan, very similar to your exposure control plan, only this is with hazard communication related to hazardous chemicals. Next is having your safety data sheets compiled along with a chemical inventory list. I'd like to say a few words about this briefly, though, because we've been collecting material safety data sheets prior to the safety data sheets, and now we have safety data sheets that some of which may be outdated, or we may have products for SDS sheets for products we no longer use in your lab. So please know you do have to archive those and save them for 30 years. They can certainly be scanned in and saved on your server or someplace where they can be accessed if your space is at a premium. And your chemical inventory list is a list of the ingredients in the chemical products that you use, not a list of the products themselves. So that's a little bit deeper definition. Third is labeling of secondary containers. And that's where I'll circle back and say, remember those red pictograms that we saw earlier for the health hazards and physical hazards? Those pictograms have to be on your secondary labels. But you use a secondary label anytime you take a product out of its original container for more than a one-time use, such as your high-level disinfectant baths. And last but not least is training, much like the bloodborne pathogen standard, train upon hire and annually thereafter. As we leave this OSHA section, I'd like to just mention that it's important to recognize that there are other OSHA standards that apply to all industries, including lab settings, and these relate to just general workplace safety. So when you're doing a review of your safety plans, don't forget your general safety items, such as fire safety and emergency evacuation plans. And when you're conducting your self-inspections, take time to be sure that you're looking for the general safety items, such as fire safety, your emergency exits and pathways, and electrical safety, because ultimately, optimal worker safety includes much more than just wearing your proper PPE. I'd like to give you just a quick update here too, that if you're not familiar with OSHA's newsletter called Quick Takes, it comes out twice a month. So if you go to OSHA.gov, and I'll have this resource for you on the resource slide at the end, that might be a newsletter that you'd like to subscribe to. But please be aware, it is more general industry specific. It's not specific to healthcare at all. However, when you think about your general environment and you're reviewing it for safety as well, there's some great updates and guidelines there. When we think about CDC, we think about the biosafety and microbiological and biomedical laboratories, also known as the BMBL, and we think about the guidelines for safe work practices in human and animal medical diagnostics. So these are 2 important documents here, depending on the nature of your lab. The BMBL is a guidance document that was introduced first in 1984, so it is not a new document. I'm sure you have the more recent copy from, I believe it's 2020 in your lab. But like OSHA, the CDC has been leading the way for healthcare worker safety for decades. And this particular document addresses safe handling and containment of infectious microorganisms and hazardous biological materials. And the second guideline, the Guidelines for Safe Work Practices, was first published in 2012. And this set of guidelines addresses a few more of the important day-to-day safety issues that affect laboratorians in settings where biological safety is a major focus. So this guidance document addresses a number of diagnostic lab settings, such as virology, TB, blood banks, and others. So if you work in any of those settings, this is a document that you no doubt have on hand. So to think about some common compliance threads really quick between what we've just been talking about, we think about biological safety and having a risk assessment done. We're going to go into the risk management 6-step process a little bit later on. And then it also ties in, the compliance thread ties in with OSHA's bloodborne pathogen standard, because there's a requirement there to do a hazard analysis as well. So when you think about what's required there under the other OSHA CDC document, these areas overlap, as I mentioned at the beginning of the program. And I just wanted to draw that quick analogy for you. To say a couple quick words about USP. We know this is a not-for-profit, science-driven organization. They rely upon independent experts for the development and maintenance of their healthcare quality standards. And we know that these standards apply to all healthcare personnel who prepare, administer, transport, otherwise come in contact with the hazardous drugs that we've been speaking about. So let's delve into this one just a wee bit more here. So look at a couple of key points from the USP 800, for example. If you have hazardous drugs in your formulary, you must have a compounding supervisor, and maybe that's you all, maybe you're here with us today, and you have already taken advantage to avail yourself of additional training in all areas of compliance, but especially with the USP standards. Just to mention briefly, one of the additional duties of the compounding supervisor is to conduct that biannual environment wipe for sampling of hazardous drug residue on surfaces. That's an important aspect of this role, to be sure that you have these wipes and the sampling and the results organized and set up in your binders, whether you're keeping them in paper or electronic, so that everything is in order should you have an inspection. USP also calls for standard operating procedures to be created and maintained for the safe handling of hazardous drugs in all situations where hazardous drugs are used throughout a facility. The SOPs must be reviewed at least every 12 months. And we haven't highlighted that, I don't think yet, but that is a point that we should make with all of your policies and procedures. But in this case, you want to be sure that you have your committee, or maybe it's the compounding supervisor, whoever is designated to review them. Make sure that you're going through these on a regular basis. Coupled with all of that is the medical surveillance that's recommended for workers who routinely handle hazardous drugs. We know that leads to early detection of healthcare problems because of exposure to these agents. And it also could help to uncover even a deeper rooted, perhaps, or a more serious safety concern within the facility. So it's a very important surveillance program. I'm sure I'm preaching to the choir here, but I'd like to mention, if you have not subscribed to the USP Healthcare Quality and Safety newsletters, put that on your list of things to do. But I'd like to pause for just a moment, because speaking of the medical surveillance program, I want to just give you one tip that's from my perspective now. This is more of my advice to you, and that is to be sure that you're always using credible sources for top quality PPE for anyone that comes in contact with hazardous drugs, and just the use of PPE in general. And I'll share with you a quick analogy, and that is the fact that back in the peak of the pandemic, I believe it was February of 2021, if I remember correctly, the Washington State Hospital Association had thought they vetted a new vendor to purchase their N95 respirator masks. So they proceeded and purchased several hundred of these masks, only to find out that they were counterfeit. So not only were they out of luck, but so were all their member hospitals that were expecting to have a new supply of N95 masks for their healthcare workers that needed them day in and day out. So stick with your known suppliers and vendors that you're working with, and stay to the track of being true to them, and have good supplies in your practice in your lab. That's just a personal thought, just keeping in mind of how there's so many different vendors and options these days. To stick with someone that you know that's well known and well thought of. So the fourth organization is the College of American Pathologists. And we know that this is an evidence-based organization, and they work with their professional partners because they're dedicated to advancing the practice of pathology and laboratory medicine. And CAP is really known for bringing to the forefront these clinical decision makings and best recommendations. So it's a real mark of distinction. And just to highlight that about CAP, because we're all in healthcare to provide quality care, whether it's directly or indirectly, to patients. And we're all about improving quality. And we know that's a continuous process, isn't it? And for me, from the risk management perspective, I'm looking at how can we reduce risk so we can actually drive up quality that you all are striving to work and improve on every day. And it's just about maintaining those high standards for all. It helps you fulfill your regulatory requirements being CAP accredited, and ultimately, as they mentioned, manage your laboratory more efficiently. I'd like to just highlight briefly that with these evidence-based guidelines from CAP, you have the ability at your fingertips to have access to the 21 discipline-specific checklists that are updated annually. So no doubt you're using those as part of your risk assessments and your annual updates, as well as perhaps their numerous proficiency training and testing programs. As we get ready to move into the fourth stretch of our program here in our fourth objective, let's talk about some ways for maintaining high standards of safety in your lab. The first tip, first of all, we don't take safety for granted, right? That's something that we have to continually work on, just as we're continually working on improving and updating our workflow and our efficiencies and our patient safety. But go back to that risk assessment of your work site. We talked about a few things already that you may have that you're using, and let's delve into those just a little bit deeper. Two that I'm going to share with you today, just to give you a fresh perspective on, or a different perspective, if you will, come from OSHA. And again, while they are not healthcare specific nor laboratory specific, they are specific enough to any general environment that could be adaptable to your work site, and they can be used in conjunction to items that you're already using. First is OSHA's job site analysis tool and their safety inspection tools. What I like about the safety inspection tools that I've pulled out for some of our clients is the fact that the general environment safety, fire safety, evacuation, egress, and the width of the evacuation corridors and all those types of things are great to go into just a little bit deeper with some of these OSHA tools. Next, we know about the CDC laboratory training courses. Those are great to avail yourself of those. And if you have not downloaded the USP Has RX app, I'm sure you all have it on your phone and mobile devices, but as a gentle reminder, a great tool for you there to help you with your assessment. And then we talked about the CAP checklists that are broken down by sub-discipline as well. But to go a little further with worksite analysis, and I want to ask your engagement here again with us, and that is using another USP infographic. This illustrates a point of contact with a hazard and the steps that relate to compounding. Now, I know many of these steps apply to other biomedical testing and development. So even though it talks about compounding here, I think some of the steps would be applicable to most lab settings. But I'd like you to look at each step in the process of this related to compounding, as well as considering each step in the process of the laboratory processes that you perform. Can you break them down into their simplest components? And what I'd like you to do is ask yourself and your team, what could go wrong at each point? What kind of mistake could be made in this step in the process? Now, please don't take that as something that's negative. The reason that I share that with you is because we're looking at something called a failure mode and analysis, or a failure mode and effect analysis. This is something that's done by many hospitals because it's part of the Joint Commission accreditation requirements. You're looking at where things could fail, so then you can identify, okay, how can we be sure that we have that covered? So let's just take spills, for example, in this section here. What could go wrong with a spill occurs? Could you not clean it up properly? Do you have incorrect PPE? Maybe you can't find your spill kit. So we're looking at different mistakes that could happen and how we could be prepared to kind of prevent that mistake from happening by always checking one step further. Another phrase would be peeling back the onion, if we will. How can we peel back that onion one more layer to find out what else can we do to have that next step of safety in place? So what I'd like you to do at this point is put something in the chat window about either any one of these steps or maybe spills in particular. What else could go wrong if there's a spill that happens in your lab? What are some things that you think of here that, or maybe you've done a failure mode before and you want to pass along a tip to the rest of us? We would love to hear what those are, because really this process of a failure mode analysis helps us to proactively think about safety mishaps that then can allow you to plan better and prepare better for safety in the end. To go further with the risk management and the risk analysis here, I promised that we'd circle back to this because it was mentioned in the biosafety and the microbiological and biomedical laboratories. But the risk management process is universal in all areas of business, all areas of healthcare, all areas of lab safety. So please take these processes. Let's think about how we can adapt them to your lab setting. And without reading the slide entirely, because I know it's a bit content heavy, let's recap the steps. The first two steps begin with identifying and understanding exposure to infectious agents. So what are the hazardous drugs, or what are the infectious agents that you're exposed to in your lab setting? Do we have all those identified? And then third, make the determination about the appropriate level of safety, whether it's biosafety level or hazardous drug safety, and look for the precautions that need to be indicated by your risk assessment. Step number 4 suggests getting another set of eyes to look at your proposed safeguards. And I think that's a great idea. This step specifically mentions the biosafety professionals or your institutional biosafety committee, but it can be the safety committee in your lab and in your organization. It could be your team members. It could be an outside subject matter, but who's helping you to review the assessment that you've done to make sure you've got all the bases and you haven't missed something. Sometimes the obvious is always right before us. And I don't know about you, but if you've ever lost your keys, that really happens, doesn't it? You lose your keys and then all of a sudden it's like, oh, they were here the whole time. How did I miss them? So how do we make sure that we don't miss important aspects of the risk assessment? Now, number 5 really resonates with me because it's easily overlooked or postponed when schedules get hectic. So as part of that ongoing process, I encourage you to evaluate just your proficiencies of the team. Do you have annual competencies that you're checking off related to safety practices and maintaining the integrity of the safety equipment? This is part of the accountability that we talked about in the very beginning of the program with those 5 elements of a safety culture. This helps to promote and create that continuous loop of accountability here. And certainly, last but not least, is revisit this risk management analysis on a regular basis and verify that any risk management or risk reduction and safety strategies that you've chosen are still necessary and relevant, and there's not something different that you need to do along the way. Next, I'd like to just remind you about reading and following your organization's protocols and standard operating procedures. You know, this is one of the most important things that we can do, but I have to be honest with you, it's probably one of the least exciting aspects of maintaining your safety culture, isn't it? Combing through your SOPs and policies is not nearly as exciting as a murder mystery, right? But when you read them, look at them with a fresh set of eyes and answer the question, does this SOP outline what we are doing in practice? And think about these 5 key words, if you will. What does our policy say? So anytime, or that can be substituted for what does our SOP say? But anytime a question comes up, whether it's from a new person on the team or even one of you all that are veterans, what comes up? Are we following? Have we deviated? Have we forgotten? Because sometimes when we get into a routine, it's likely that we can miss a step. And I'll give you a quick analogy. Here in Florida, all healthcare providers have to take a continuing education course called Preventing Medical Errors. And long ago, I remember reading from probably Dr. James Reason, a psychologist or one of the other top researchers, that the more steps in a protocol or the more steps in a process there are, the more likely we are to skip steps or combine them or get them mixed up. So going back through your SOPs to make sure they're very clear and up to date is critical. And needless to say, it's required for all the accreditation organizations as well. Next, as I mentioned in one of the safety slogans in the beginning, if you see something, say something. If you identify hazards, speak up. It's not about being negative, but it's about bringing a process to the forefront that can be improved. So it's never about pointing fingers. It's always about improving that process. Because as an aside, one more tip here about non-compliance is that OSHA violations are now over $15,000 per day per violation. And OSHA just published an announcement earlier this year stating that their auditors now have the discretion to cite each violation with independent fines and not group some of these violations together for a lesser fine. So that gives them leeway to kind of just even create bigger fines. So if you identify hazards, speak up and say something. Ultimately, be solution oriented. Everybody loves it when somebody can bring a solution, even if you've tried it in the past. Maybe now we're trying it with a fresh set of eyes or from a different perspective. And lastly, on this slide, I'd like to say that training doesn't have to be dry and boring. In my career, I have known teams that have watched the same training video year after year, and you could tell they didn't learn anything new and they didn't even enjoy it. They were too busy eating their pizza. So while you don't have to be a comedian or a magician to create something interesting, fun training or little exercises, just a little imagination. And I'd like to wrap up the program by circling back to 2 things that struck me in the LinkedIn article that I mentioned on continuous learning. First is that continuous learning opens your mind and changes your attitude by building on what you already know, and it changes your perspective. So the more you learn, the more you'll become better at seeing different sides of the same situation and different perspectives. It just changes your perspective. Second, believe it or not, continuous learning is not just about you. So pay it forward. Lifelong learning helps develop your leadership skills, which then translates into fostering lifelong learning in other individuals by encouraging them to pursue a culture of safety. So ultimately, I encourage you to have fun and be a little nutty for safety. So as we wrapped up, here are the resource links that you'll be able to grab later for just some great things with OSHA state plans and USP, CDC, and so forth. And right now, I think we're ready to open the floor for any questions and answers and look at some of the engagements that maybe you put in the chat window. So let me take a look here and see what we have. Okay, I have some great answers here for when it comes to our shared values and the 5 elements of, we talked about those values. So let's look, shared values. All right, that was what someone thought. Continuous learning, accountability. Yep, continuous learning. Great. Thank you. Thank you for that. And listen closely. You know, that is so important. I just want to say that listening is so important because we think we listen, but we're not always hearing. So when you're listening, we're taking time to resonate and to use our eyes, our ears, and in healthcare, we use our heart, don't we? So it's about using all of our senses and us not just assuming that we know what somebody's going to say. But continuous learning, as another focus, someone's popped in the message here, is staying on top of the current regulations and trends. I tell you what, things have seemed like they've changed so fast since COVID, or at least life seems like it's moving so much quicker at a faster pace since we've had the pandemic. So it's just really, really important to stay on top of those and keeping safety in mind. Absolutely. So change it up, have some fun safety slogans and some different things to keep it fun and easy. So I'd like to see if there's any other questions, and I'm not sure, Beth, if you or Lindsay are covering questions. Okay. So, okay, someone says they're in need of additional poster with the red diamond pictograms. So yes, the red diamond pictograms, like I showed on the slides, you can download that from the OSHA website. OSHA has what's called their quick take notes or quick notes. When you go to OSHA.gov, there's a great toolbar, A to Z toolbar. So when you select on that, go to H and then drill down to hazard communication, it takes you right to that page with all the hazard communication resources and tips. You can download a current copy of the law from there if you don't have the one from 2012 when it changed, adding in the pictograms. Those pictograms are extremely important because you'll see them actually in 3 places. You will see them on the original containers of the products you have, outlining what the hazards are because the manufacturers and importers are required to do that. You'll see those pictograms on your safety data sheets, another place. And then third, you'll see them on any secondary container labels that you have. So it is important to have an updated copy. So check out OSHA.gov. Any other thoughts or questions that we have? Did anyone have any, what was the last question? Any tips on safety when it comes to failure mode? I don't know if anyone has conducted any failure modes or not. Okay.
Hi, Linda. I had
Yes.
one comment. This is Mike Stack in Pittsburgh with Thomas.
Hi.
Thank you very much. That was awesome. I appreciate everything that you said, and especially on my end, I work and volunteer in the weekends with a youth program. And when you talked about what you were able to see on LinkedIn about continuous learning, we always emphasize that with our leadership and also our youth. That you never know everything, and be open to listening and having a conversation with somebody, even though we may have differences, that we can learn from each other and find out what we do have in common. And in addition, that you can then utilize that to help other people to pay it forward. So that was spot on, and appreciate you adding that to your presentation.
Well, thank you so much for sharing that. And how spot on is it that you are helping, younger folks to recognize and have that ability early on, because it will just be a success tool for them in education and in future employment and working with teams and families and just everybody. So it's a great thing you're doing. That's wonderful.
Well, they have so much access to information, obviously now through social media and through the internet. It's so much different than when many of us grew up, when we didn't have that access and you had to really go looking for it and put a real effort in. And so today it's, you still have to make that effort and be able to filter out the noise, the negativity, and to stay positive, to stay balanced.
Exactly.
And,
exactly.
Yeah. Thank you.
Great.
Appreciate
That's
it, Linda.
great. No, thank you for being here. Thank you for just sharing your thoughts as well. Any other questions? Exposed to hazardous drugs in clinical pathology setting is another question. So let me check with one of our other experts on some of those particular clinical ones. Mike Fleming, are you able to possibly address the question, are you exposed to any hazardous drugs in a clinical pathology setting for us? So we can differentiate that very carefully, please.
You know, knowing that it's more about the bodily fluids and the tissues
Mhm.
and not about the compounding, I think the chance is very little, but it's always I would always recommend err to the side of caution when it comes to worker safety and protection. So if there's a doubt, I would double glove and make
Mhm.
sure that you're protected versus taking that risk.
And, you know, on top of that too, it comes back to the hazard assessment and helping to identify if you have hazardous drugs as well as in the clinical pathology setting. So starting off with that and a good chemical inventory list and a good safety data sheets as well. So very important. Well, I don't see
Absolutely.
any other questions. Thank you for your assistance. Any other questions? And I think that draws the conclusions to today's session. Unless there's any other thoughts or wrap up, I'd like to thank you all for joining us and thank you for your support this afternoon.
Thank you, Linda.
Thank you.
You're
Great
welcome.
job.
I
Thanks,
think
Linda.
you're going to show us the environment real quick. I want everybody to jump into the expert series and the O&M Halyard kiosk and take a look at all the resources they've put in there to help support our talk today. It's this easy. It's loaded with PDFs, web links, and videos. And please take a look at their promotion. I believe if you take their survey, you're entered into a drawing, but take a look and click on everything. Thank you again.